Today we're joined by Lieutenant Governor Andre Bauer, who's in charge of the Department of the Office on Aging. Now, Andre, you have some special things that are going on with that office that you want to tell us about. I understand you're going to be covering some topics at a town hall meeting, correct?
That's right, Mike, and it's an exciting time after just wrapping up another session of General Assembly where the legislature was very concerned with seniors and allocating funds to make sure we look after our aged population. South Carolina, as you know, is now the 5th biggest state in the country for in-migration of new seniors. So a huge economic boom to so many of our communities, and a lot of folks that have money to spend. And of course, that helps in communities where we have folks that can't quite take care of all their needs. But next Monday, we are going to have a meeting to hear concerns and issues that need to be addressed and go ahead and formulate plans for the next coming legislative session so we can hear those concerns and formulate an overall plan as to what we want to work on for the next legislative year. But some of the big concerns we hear are transportation. After a decision was made to change the formula of how we chose people that would give Medicaid transportation dollars, and some out-of-state companies were picked to provide this transportation, we're hearing horror stories now, Mike. All kinds of things about people being left at doctor's office all day and not picked up, and nobody's there feeding them, taking care of them. We're talking about seniors that may be going through dialysis, people that are on oxygen, cabs being sent to pick them up at their homes and take them to hospitals when it should be an ambulance. I mean, all kinds of horror stories. And so we want to get to the bottom of it. We want to find out really what's going on, and we want to see how we can correct the problem. Our office, for example, has requested a copy of the contract that initiated this program. Still have not received a copy of the contract, so I'm concerned. I want to get to the bottom of it and find out what's really going on and how we can improve these seniors and the services they're supposed to be getting.
Yeah. Now, why is there such concern over the new method of the Medicaid transportation?
Well, anytime you've got seniors with this amount of horror stories, you got to look into it. There has to be something more going on. We didn't have these concerns before. We weren't getting these types of calls with these types of stories, and so something has definitely changed in what's being done as far as delivery of goods and services and transportation. It's a new formula. It's new folks giving the services out. Maybe we can get in between the two of them and say, look, you're going to have to change your policy of how you're providing these services. It's because it's not up to par with what was being given before. Maybe you did cut the cost by a few cents per transportation of each individual. But in the end, if the service is far substandard as to what our seniors were getting before, then it's not really a value or a bargain. And so we want to look at the contract. We want to find out what's going on. We want to hear the stories from the individuals directly. I want to hear them for myself so I can go back and see what can be done to correct this egregious problem.
Now, I'm told that you have there's been some horror stories that have gone on with this. I mean, do you have some examples of some things that happened?
In Orangeburg, for example, a woman with many different ailments, a cab was sent to pick her up. You know, that's not how we expect our seniors who have ailments to be picked up, to taken to the hospital. We've heard of people just being left all day long at a doctor's office, and the doctor's office was saying, look, we can't provide all-day care for these folks. You know, that's not our job, and we don't have the time or the resources to do that. So who's to feed this individual when they're waiting all day and the person doesn't come till almost the evening to pick that senior up? That's not how it was supposed to work. That's not how it worked previously. And so we've got to do better than that, and we've got to get to the bottom of the understanding between the two parties, us being the taxpayers in the state of South Carolina and the company that's administering the transportation.
Now, are other branches of the state government being helpful in this, or what's happening?
Well, HHS is actually who administers this, and we've asked for a copy of the contract, still waiting. And of course, it's the biggest agency in the state government. It administers billions of dollars out to our state's population, and they got a lot of things going on. And one of the toughest things, Mike, is that they don't have a director anymore. And so we really got a problem there with somebody's got to go ahead and appoint a new director to the office.
And who would be that person that appoints a new director?
Well, that's a cabinet appointment. It's done by the governor of the state. The interim director steps down this week. So who's to fill the shoes? Who do we talk to? We're having a little bit of problem in communication and getting the information that we need. And so somebody's got to fill that void. I know I had a vacancy last year, and I sent my chief of staff to run the Office on Aging in that time period. And I think that's the duty of who you've got in your office to fill those voids. When you've got lieutenants out there, they've got to fill the holes wherever they come up, and that's part of being in the executive branch. And so we got we got to move forward and tackle these issues. And the summertime is the best time to do that because the legislative body is not in session, and we're able to get other legislators to come to some of these. Hopefully some will show up Monday morning in Greenville, and they can hear what's going on, and they may have some ideas on how to fix some of these problems. You've got so much institutional knowledge with folks that have been in the legislature far longer than I've been in there, and a lot of them know how to deal with some of these problems because they've seen them before. And it's not about what's causing the problem now, but it's how can we fix the problem, I think, is the real issue at hand here.
And for people who want to attend the meeting, what's the date and time?
It's
location?
the 16th of July. It'll be in Greenville County Council chambers Monday morning, 9 o'clock. And we hope to hear from folks. And of course, anytime folks have an aging problem or an issue that they need to talk to somebody, they always dial 1-800-868-9095, and that'll put you to the Lieutenant Governor's Office on Aging. We want to hear from folks. We want to, if there's a program that you think is especially moving well or working well, we'd like to know about that. And of course, things that aren't working well or folks that do need help, we're there to help, and that's part of this program. And that's why the legislature 3 years ago put the Office on Aging under the Lieutenant Governor's Office to get more attention brought to the office to address our state's aged population and the needs that they have addressing them.
Now, Lieutenant Governor, I understand that seniors are moving to South Carolina in record number. What is this doing for South Carolina?
Well, it's incredible what it's doing, Mike. I talked earlier. It is an economic boom to our state. If you look at Lancaster, for example, one of the most rural parts of Lancaster County, now has a huge senior development. And we're talking about homes $300,000 and $400,000. Of course, they have no children to educate, so you imagine what it does overall to the education budget in that county when you've got all that new revenue coming in and no students additionally to educate. We've got seniors. We're now the 5th biggest state in the entire United States of seniors moving in. And the average senior that moves to South Carolina, over $1 million in assets, over $100,000 in annual income. These are the kind of folks we want moving to South Carolina. They can pay for their health care. They're not using a whole bunch of services, but yet we're the benefactors of them banking, buying homes, buying insurance, buying home insurance, and spending money in stores and traveling. So this is great for our communities. And a lot of them want to volunteer and give back. They're volunteering in the public schools. They're working for charities. They're doing more to help their communities. And so this is the kind of thing we want. A lot of people have now called, some of them even halfbacks, where they move from up north down to Florida and they've come halfway back home. And we're glad to have them. South Carolina is blessed because we've got so many wonderful things. Beautiful people, a climate that's very enjoyable year-round, taxes that are fair, and beaches or the mountains, you take your pick. And so, of course, the top 3 counties in the state are along the coast for in-migration seniors, but we're also have seen a huge boom to the mountainous areas of the state and some of the even small rural towns that they want to get that real charm. And so I think we are blessed to have what we do have happening, and it's one of the bigger things that's caused the tax base to increase in our state this year.
Well, thank you so much, Lieutenant Governor, for your time.